Fibroids are benign growths of the uterus. They range in size and can grow within the uterus or push outside the uterus. They are very common. 3 out of 4 women will develop fibroids in their lifetime. The exact cause of the fibroids is still unknown, but there are some things that can increase the risk of developing fibroids. For example, women with a mother with fibroids are more likely to develop fibroids. In addition, increased exposure to estrogen hormone may increase the risk of developing fibroids. And obesity or getting your period at a younger age or delayed menopause, these are also increases the risk. Birth control pills do not increase the risk of fibroids. They do not cause fibroids. We use birth control pills to control heavy bleedings that may occur with fibroids. Fibroids are more common during fertile age. More than 7 out of 10 of women having fibroids by their late 40s. Black women are nearly 3 times more likely to develop fibroids compared to white women. They can also develop fibroids at a younger age and have more fibroids and also larger and more symptomatic fibroids. Most people with fibroids will not experience any symptoms, but some others experience symptoms that may significantly impact their quality of life. The common symptoms of fibroids are heavy bleedings, prolonged periods, pain with periods, bleeding between periods, and pressure in pelvic area. Fibroids are not cancer. They don't increase the risk of uterus cancer. This is important to note. Some fibroids, especially in certain locations or certain sizes, may impact fertility, and some fibroids increase the risk of pregnancy complications. These complications are miscarriage, increased risk of C-section, more bleeding during delivery, and etc. How we diagnose fibroids? For women with fibroids who want to become pregnant, ultrasound and MRI can be useful to understand the location of the fibroids and the size of the fibroids, and how the fibroids may impact the ability to become pregnant, and also how they impact the pregnancy itself. Often, fibroids are found during a routine pelvic exam or found on an imaging that may be done for a different reason. Sometimes your doctor may notice an enlarged or irregular shape to your uterus and may suggest that you have fibroids. Ultrasound is the most easy and the most cheap way to diagnose fibroids. Ultrasound also can distinguish fibroids from other pelvic masses. The treatment of the fibroids depends on what symptoms you have. Women with no symptoms, watching is enough, especially women in her late 40s. Sometimes just waiting and managing the symptoms may be preferred. No need to surgery, because bleeding will stop and the fibroids will decrease in size after menopause. For women with heavy or painful periods, drugs like non-steroid anti-inflammatory drugs or hormone drugs like birth control pills or hormonal intrauterine devices may be very useful and helpful. But for women that drugs don't work, don't help, or women that have severe symptoms, severe pain or pressure, we have to use surgery. Surgical treatments are: first, myomectomy. Myomectomy is removal of the fibroids but leaving the uterus intact. And the second one is hysterectomy, removal of the uterus totally, but not ovaries, only the uterus. And we do myomectomy usually laparoscopically in our clinic, in Istanbul Gynecology Clinic. And almost always we do hysterectomies laparoscopically. So when discussing which treatment is right for you, your doctor will discuss the symptoms, how affect your daily activities and your quality of life, and most importantly, do you want to become pregnant in the future? If you have fibroids or think you might have, you should contact us to discuss which treatment is best for you.